All right. We are live. Peace, love, and blessings, Miami Gardens. It is an amazing day, and I am so grateful to be with you here on today in our Live Healthy Miami Gardens segment. We thank God for being able to give always healthy tips to help us and live Miami Gardens, and those who are joining us through work and play with being as healthy as we can possibly be. And so this week, I am Dr. Cheryl Coleman with Abundant Living. I've had the privilege to work and collaborate with Live Healthy Miami Gardens over the last couple of years, and it's been amazing. And I'm grateful to be able to host our segment on today. Just a little bit of our reminders about this particular segment that we have. We want to remind you that Live Healthy Miami Gardens was born from the realization that through health, which is largely influenced by the individual's choices, the conditions of their communities in which they live, they work, they play in. It plays a major factor in how healthy individuals are. And so we're grateful for Live Healthy Miami Gardens. This community initiative has been in play for a while now in our city. It is, again, aimed at helping us to be a healthier place for all of its residents. And again, those who are connected to the Live Healthy Miami Gardens area. This initiative is in part the city's effort to reduce poor health outcomes by engaging our community residents to improve the selections of their choices. And again, it's all about the environment and being sure that we're educated, armed, and equipped. I remind you, lastly, that Live Healthy Miami Gardens is not just a city effort, but it is truly a community engagement initiative. It's been in existence since 2014. The city has been working collectively with over 110 community stakeholders and 66 organizations, again, that's focused on 5 health impact areas: alcohol, tobacco, and drugs, physical activity, healthy eating and nutrition, mental health, and primary health. And so, again, I'm grateful today to be your host. And as we think about all of those initiatives that Live Healthy Miami Gardens focuses on, we cannot begin to share with you how important it is for us on today's topic, although we're all probably COVIDed out, but we are still in the fight. And so today's segment is just to bring a few highlight and the reminders that we're still in this fight, but we don't have to do it in despair because we've got the tools to be able to make a difference. And so again, I'm sharing with you Dr. Cheryl Coleman with Abundant Living Health and Wellness Resulting Services, which is a nonprofit that really focuses on health education and addressing health disparities. And so I'm absolutely excited to be a part in collaboration with Live Healthy Miami Gardens. We're going to be sharing with you, as our slides come up, just a little bit of information to remind us about this fight that we're still in. And so as we're getting ready to do that, the next slide, I'm grateful. Again, I've already shared with you Abundant Living. Again, we work with communities and also faith communities as the change agent to help to bridge the gap to keep us healthy and whole. A lot of our work, again, is faith-based and also in the communities. It's our goal to be able to help individuals. There are 10 dimensions of health, and COVID-19 has affected all of those spiritually, mentally, emotionally, intellectually. It has infected our environment, social, the way we work. That's our occupational, financial. And lastly, it has affected us on our medical dimension. And so as we think about that, we're going to dive right into giving us some reminders about this fight. Go to our next slide. We are going to be looking at the next slide. We're going to be looking at some reminders about this fight that we are in. And so as we go through that, we want to share that we have faced the biggest health crisis, COVID-19. It continues to really wreak havoc in our communities and in our families. I share with you, as the next slide is coming up, COVID-19 was the 3rd leading cause of death in the United States in 2021. And so we have seen so many people. Normally we have focused on heart disease and cancer. which have been those that have been leading us. But as we think about that, COVID has slipped in at number 3. This information comes to us from the Centers of Disease Control and Prevention. We really utilize them for helping to guide us through one of the major health crises that we have ever faced. And so as we share that, we are grateful that in this fight, we have made a lot of progress with this deadly virus. And we've done so with vaccinations and all of the new treatments that we have been blessed and fortunate to have with us. And so COVID-19 prevention and detection, it still remains a priority for us. And I share that because one of the major things that we need to know as we're moving through this in our communities, we want to make sure that we know where we stand in our community. And in our community, we're a part of the Miami-Dade County. And in Miami-Dade County, there are several risk factors that you look at from a community perspective, and they are high, middle, and low. And based on where you are is how we use the tools that we have been given to fight this disease process. And so I share with you as we're getting ready to go to the next slide that we in Miami Gardens, right, as a part of Miami-Dade County, we are in what we would call high community status. And so because we are on high alert in this, we are wanting to make sure that we know the tools that we have to continue to navigate this. Now, we know that this is really like our new normal. That's one of our campaigns with Live Healthy Miami Gardens. We know that there are new variants that are occurring with this virus. And so because of that, it is essential for us to be able to protect ourselves and our loved ones. And so therefore, we're going to spend a few moments today talking about some protective measures that we have that's going to really be a blessing to help us to slow down the spreads with these variants. We know that Omicron was really that one that's really highlighted as of recent. And we know there's some other variants that are out there that are spreading quicker and that it's continuing to still hit us. And so we're grateful again, as we're getting ready to go to the next slide, to just go on and share the tools that we have to fight this disease process. And so as I'm sharing with you, what's the first tool that we have? I am glad that you asked. The first tool that we have in this fight that we're still in is vaccines. That's right, vaccines. We went through 2020. A really rough time. We saw that we lost so many loved ones as we were in the space of trying to come up with what we were going to do to be able to navigate. And again, vaccines, we were blessed with having them. And so we share, this is a tool that we have. And I pray that you have been vaccinated. If not, we want to make sure that you're educated, armed, and equipped with the importance of vaccines. Getting vaccinated and staying up to date with our boosters is vital for us in this fight. COVID-19 vaccines, they are highly effective in preventing severe illness and hospitalizations and most definitely deaths. And so we want to just remind us of these. Again, I know that we probably say, oh, I know this, but guess what? Sometimes we need reminders because we get laxed in this. And again, it's about saving lives and it's about the quality of lives. So getting vaccinated is the best way for us to slow the spread of this disease process, right? And continue to emerge as victorious as we can as individuals who are in the fight. And so we know that our CDC recommends, they give us recommendations and they're giving us good guidance that everyone who is eligible to get the vaccine, that we would do so, and that we would make sure we stay up to date again with those boosters, especially for our people who have weakened immune systems. And those are people who have chronic disease processes like diabetes, heart disease, cancer, hypertension. Again, there are many disease processes that make us vulnerable to this COVID-19 and the quality of life. And so vaccines is definitely one of those tools. For that, as our next slide comes up, we're going to see what other tools we have besides vaccines. And guess what it is? It's wearing our masks. Yes, I know that we are tired. We're probably all masked out. But again, this is one of our tools that we have in this fight. And so we want to make sure that we don't get lax. We wear our mask as needed. And so as we look at our CDC, it tells us everyone ages 2 years and older should properly you wear a well-fitting mask, whether you're indoors or outdoors, especially as it relates. I started off telling us about our community level. Our community level. Right now, we're still at the high alert, which means transmission is still high. And so, if you know that you're in that vulnerable population, wearing our mask is one of those tools that helps us to fight a COVID-19, regardless of our vaccination status. And so, the mask, we want to make sure that it fits our faces comfortably and covering our noses and our mouth in a very comfortable way. If you are sick and you need to be around others or caring for somebody with COVID-19, we definitely want to make sure that we're wearing our masks. One of our tools to help us to combat this disease and maneuver through it for those that may already be affected or those who are compromised. If you are at increased risk for severe illness, or you live with somebody at higher risk. Remember, we're in this fight together. We have to think about one another. We want to make sure that we're doing the things to protect us, not just individually, but collectively. Always working with our healthcare providers if we're unsure. So because our community level risks are higher, and as we think about those that we love who may be compromised, we want to make sure that we are wearing our masks to protect them and also to protect ourselves. And so wearing our mask is another tool that we don't want to forget about in the midst of this COVID fatigue. What else do we have in our toolkit to fight COVID-19? Well, we talked about vaccinations and a mask and when to wear a mask. Let's talk about another tool that we have, and that is testing. Yes, yes, yes. As we move to the next slide, testing is another one of those tools that we have. And so in order to help us with the spread of this disease process, we want to make sure that we are testing appropriately as we move to the next slide. Test to prevent the spread to others is very important to us and to our own self-care. And so we want to make sure that we're doing that. We recognize that there are different types of tests. There are tests that are called molecular tests. These are tests that are more definitive in our medical community to let us know that if we have present infection at the time of test. And so if you take one of those tests as you're working with your healthcare providers and that test result is positive, more than likely it means that you have the infection. And so therefore you need to start doing those measures in our toolkit to begin to move onto your journey of healing, but also to protect others by isolating and then also informing others that you've been in close contact with. These are things that we don't need anybody to tell us to do it. These are just simply the right things to do. And when we do those, it's able to help us to fight this infection. As we think about testing and move to the next slide, I shared with you about molecular testing, but there are other types of testing. And this type of testing is our over-the-counter test or our self-test. And these types of tests are used at home or anywhere. They're easy to use, and they help to give us some rapid results to kind of let us know where we are standing as it relates to the disease process, whether you have symptoms or not. And so these self-tests are very important to us. They are tools that we have in our toolkit to fight this disease process. And so as we think about all of our tools, vaccination, masking, we do have, of course, physical distancing. But again, testing is one of those ways that we do not want this to fall off our radar screen. And so testing is important if we've been exposed or somebody shared with us. But testing is also important because we're back out in the community. We are gathering together. And so again, self-testing can also help us in preparation for events that we're going. We're talking about tools in our toolkit as we move through this new normal time of COVID, what we can use to stay safe. And so again, we've got vaccination, when to wear our mask, and we have testing. And guess what? As we move to the next slide, I am a nurse, right? And as nurses, one of the first epidemiologist, which is Florence Nightingale, the nurse of all nurses, who made a difference in the Crimean War when people were dying, right, of multiple infections. And she saved so many lives by doing just what we're going to talk about. That's hand washing. Yes, hand washing is in our toolkit in this fight that we're still in as we move through our new normal. And so we want to wash our hands. This is something really important that helps us. It's kids are going back to school, right? And so we want to not only do our hand washing, but we want to encourage our children to do their hand washing for 20 seconds or more, making sure that you're using soap or water, right? And of course, washing those hands after coughing and sneezing. It's very, very important. We want to make sure we're washing our hands. And you might say, Dr. Coleman, this is basic stuff. Yes, it is. And it's in our toolkit. And we want to be reminded, washing our hands before we prepare our food, before we touch our face, before we are going and before and after in the restroom, right? We don't want to take these things for granted. When we're touching our masks, when we're changing diapers, when we're definitely caring for somebody that's sick, when we're handling our pets and our animals, remember, basic hand hygiene saves lives and helps us during this process as one of our tools in our toolkit as we're fighting through COVID-19. Again, if you must touch your eyes, your nose, your mouth, make sure that you are washing your hand or sanitizing. Yep, we're moving through these tools that we have in our toolkit. Guess what? I got another very basic one. When we are sneezing and coughing, we're getting ready in October to get into the flu season, right? So the flu season on top of COVID-19 are challenges for us. And so as we move to the next slide, we want to just remind us, very basic, if we are coughing and sneezing, if you're wearing a mask, you can cough and sneeze right into your mask, right? But try to put on a new and a clean one and wash your hands as soon as possible. Again, these are basic tips that we need nobody to tell us to do. We just do the right thing, caring for ourselves individually and collectively. If you are not wearing a mask when you're coughing and you're sneezing, right? You want to make sure that you have some tissue, right? And as you have that tissue and you throw away in the trash, you want to wash those 20 seconds with soap and water. And if you don't have that, you want to use hand sanitizer. Live Healthy Miami Gardens is just reminding us, right, of those tools in our toolkit as we move through and navigate through this COVID-19 process. I know that we can get fatigued, but if we use the tools in our toolkit, there's not anything that we can't overcome. Guess what's the next tool? I'm glad that you asked. Not just covering with cough and sneezing, but as we move to the next slide, cleaning and disinfecting. These things help us in our household, in our schools as our children are going back, in our places where we're working at and having to have contact with surfaces. This is something that's very effective in our toolkits to wipe down our tables, our doorknobs, our switches, our countertops, our desks, our phones, our keyboards, our toilets, our faucets, and our sink. Wash, clean, and disinfect. Again, when this first happened, we couldn't stop cleaning, right? Everywhere we went, we were wiping down those surfaces and things that we touched. We want to continue to do the same thing as we fight the good fight of faith against COVID-19 with our tools and our toolkit. Now, again, if you're in professional places and you need guidance on what kind of disinfectants that we can use, well, on our CDC website, it gives us a list of those different types of disinfectants that you can use according to the places in which you live, work, serve, or play that would best help you to sanitize your environment. Again, that's one of our dimensions of health. And so we're moving. Another as we've talked about the tools in our toolkits, we want to also now just educate us and give us some reminders of, on the next slide, if you were exposed to COVID-19 and you are not up to date with your vaccinations, then how should you roll in this new normal and this time? Well, I'm glad that you asked. If you were exposed to COVID-19, meaning somebody shared with you that they were positive and you were in close proximity with them and you've not been vaccinated, you want to kind of quarantine for at least 5 days, right? And that means kind of stay home for those full 5 days. Wear your mask if you must be around others. Try to avoid the traveling. And I know it's hard. We're living in a different time where we're up and we're moving about, but these are the right things to do if we're able to do them. Make sure that we're getting tested, right? If you don't have symptoms, still take your test and then get retested 5 days later if you know that you have been with individuals, right? You might not have had those symptoms yet, but you still want to be cautious, right? After you have done that quarantine time, that means pull back and stay. Now, if you can't totally quarantine, right, and you don't have symptoms, still wear your mask as you are out. After that, you want to continue to watch, your body for symptoms up to 10 days after you've had that real close contact with somebody, right? And it's a best to avoid travel if at all possible, traveling from state to state, because we're talking about how we go through the new normal and how we protect ourselves, and not just ourselves, but others that we're in the community with. If you develop symptoms, then you know what to do. You should isolate immediately, right? And get those tests. Again, take precautions over the next 10 days. If you must travel, the precautions, the tools in the toolkit that we just talked about, you want to make sure that you're implementing them. And most of all, stay away from those who are compromised, that you can cause them to be very, very sick. We've got tools, we've got more advancement with medication, but again, we don't want to take any of that for granted. As we move to the next slide with these reminders, as we're navigating this new normal, if you were exposed to COVID-19 and you are up to date, there are benefits in being vaccinated. Yes, there are. Then you don't have to necessarily quarantine. Now, these are guidelines, right? But you always should work with your physicians because everybody was fearfully, wonderfully, and uniquely made. But again, I'm sharing with you guidelines. If you have been up to date with your vaccinations, and you might have been exposed to someone, you're not going to necessarily have to quarantine if you don't have any symptoms, but you definitely want to get tested, and you want to use the tools in your toolkit. That is still wearing your mask. That's the hand washings, right? And that's the testing. You want to do that. And then you want to watch over the next 10 days or so your own symptoms and how your body is feeling in addition to this. Also, if you develop symptoms, then you're going to go back to some of those things that I just shared with you to do the right thing for yourself and for those that you live, work, and play with. Again, as we think about these tools in our toolkits and reminders of how to navigate through it, we share with you also if you were exposed to COVID-19 and have had confirmed a COVID-19 within the past 90 days, it's a little bit different. Again, I'm sharing with you our CDC guidelines, but always work with your physician and then ask the questions. You have Live Healthy Miami Gardens have major partners that you can connect with to be able to ask the questions that you need so that you can get the proper care. Again, not necessarily quarantining, but we're going to encourage you to use the tools in your toolkit, again, to protect not just yourself, but others that you may come in close contact with. And so again, that's reminding, and most of our slides is reiterating those things. You want to watch over the next 10 days. You want to wear your mask. You want to wash, sanitize, and do a great hand hygiene in the midst of that, and cleaning around your surfaces. We're almost there. We're almost there. If you have tested positive for COVID-19, or you have symptoms, regardless of your vaccination status, and this is on our next slide that I'm sharing with you, right? You've been exposed, right? And then you now have the symptoms of it, regardless to whether or not you have been vaccinated. You want to at least stay home for 5 days, right? You want to wear your mask. You want to not travel, right? And you want to do these things for a full 5 days as you're working with your physicians and getting your retesting after that, and taking whatever your prescribed regimen is for you to get well. You want to begin to do that so that you're able, again, to get the healing that you need, protect yourself, and also to protect others. Again, I just shared with you that last slide. The whole purpose of this segment, as we're coming to an end here, was really just to remind us, because I know that in this time and in this season, we've gotten COVID fatigued out. And so we wanted to remind us, even in the midst of this, we don't have to get weary and well doing, but we also need to be smart about this process and use the tools that we have been blessed with. As we are coming to the last slide here, this is a public health fight. And because it's a public health fight, it's going to take all of us, as we're moving to the last slide, it's going to take all of us in this fight together. As we're sharing this with you, and again, I'm grateful to be the host on this segment today. A lot of the information I share with you is probably a knowledge that you have, but reminders that as we have the knowledge is no good if we don't apply it. And so I know that we've been weary in this process, but we want to stay faithful. We want to stay diligent. We want to stay informed. There's more information as we're getting ready to get either vaccinated for the first time or boosted, as we are learning and growing through this together with our medical dimension of care. That's with our science and with our physicians leading and guiding us in this effort, which we're so grateful for. We're looking at improved boosters and vaccinations that cover more of the variants. And so we want to make sure that we're up to date. And if you've not gotten vaccinated, we pray that you get the education and work through those fears or anxieties so that you're able to protect yourself. Again, the vaccinations, they save lives, and that's what it's all about, saving life and also quality of life, because those who have experienced COVID-19 may have healed over there. There are some long-term effects, and we're still moving through that as a medical community. And so again, we're grateful for Live Healthy Miami Gardens bringing us to this. We must stay informed because we're in this fight together. We must use the tools in our toolkits. Those are the protective measures. We don't have to have anybody to mandate anything for us. If we know the right thing to do and we do it for us individually and collectively, this new normal, we're able to do it, maneuver through it, and again, support one another through the process, and also to try to decrease the spread and ultimately soon to just really combat this disease process. I encourage you, as we're getting ready to close out, to please work with your healthcare providers. We're so grateful. I shared with you their 10 dimensions of health. I've been blessed over almost the last 30 years to serve in the medical dimension with amazing doctors and nurses, and physicians, health educators. We want to make sure that we're working with them so that we're able to individually care for ourselves and collectively. Again, we're in this together, and together we can do anything. And so we're grateful. This is where we are. We're ending our segment on today, and we pray that whatever we've shared with you will be a blessing in this fight together, using the tools in the toolkit through this new normal that we're in this fight against COVID-19. That's been our segment for today. Again, we're grateful for everything that Live Healthy Miami Gardens is doing, not just them and our city, but also for the residents and also for all of the providers. We're in this together, making a model for others to follow as we live, work, and play, creating a healthy environment. God bless you. And so we're going to be signing off on today for this segment.